The problem of COVID have affected everyone, and I believe it's not yet over. I work in HIV and other programming, so my interest is how do people feel COVID-19 is affecting their HIV programming. At the grassroots, I want to look at different views and understand the challenges people are facing and what might be the effect of COVID on HIV. We've been struggling so much to save lives, but right now we're stranded with COVID-19 and we don't know how it is affecting people at the grassroots. Those that we have reached, we have realized that many of them have faced a problem of accessing services. They've faced a problem of refilling their medication. So adherence has been affected. And everything is at a standstill. However much we work, people still need to be reached. People still need to be seen. People still need to be helped to survive.
First of all, lockdown brought a lot of problems. People were at home, so whenever they get a chance to get money for food, they will just go there, not even thinking of protecting themselves.
We have had quite a number of cases of increase of HIV infections amongst this period of COVID-19. Most of the people don't get their medicines, their medication from their areas of locality. That means they have to travel longer distances if their due date is within a short period of time, which means people could not get access enough for these life-saving medicines.
Patients have not been able to get their medication because of limited movement. The health facility is far away from them, so they can't really get to the hospitals or the health centers to pick their medication. So it has really affected them very much. People are not working, they're not feeding well.
We are under lockdown. People aren't able to access their medication.
When the government of Uganda came through to say you can get medication from any area which is nearer to you as long as they offer art services, it was far long overdue. And you're going to find that most of the community members who are already doubly stigmatized, HIV positive, but also because they belong to a minority or marginalized group of people, there has been quite a lot of stigma to themselves that I can't go to this place. After all, if people come to know about my status in this or other way, then they will not be able to welcome me anymore in the community.
Others went up countries or to the villages because of lockdown. Getting drugs for them, it was very, very hard. And others, lockdown found them where they had gone to work. No phones, no what. So to get them, it was very, very, very impossible.
Because most people are now concentrating on COVID, ignoring the fact that HIV is there and it's killing people.
We have tried to devise means to see how we could solve this, but this needs quite a lot of incentives in terms of investment to see a change which is needed this way. That means that you have to move from home to home of the people you know in your vicinity, in your community who are on art, so you provide art to them. That means moving, and moving on a bike is money.
Most people, due to the lockdown, especially the teens, when they get a chance to get out there and get someone to have sex with, because you're in lockdown, you can't access it, so they tend to ignore the measures of preventing it. All they want to do is satisfy their sexual desire.
Most of them don't actually get something to eat at home, and most of them don't work. There has been quite another problem. I happen to be working in inclusion, and we see that more than 80% of the youths in Uganda either underemployed or are not employed at all. So that's a real big issue. And if you factor in the fact that these marginalized groups are having higher and higher rates of unemployment, you know that people are starving at home and they need something to take on.
Ensonga ya COVID-19 oba tugiraba ng'ensonga egenda okwongera ku bungi bw'akawuka lwa nsonga lockdown erese abantu bangi ng'ebintu byabwe ababadde balina bye bakola nga tebakyabikola abamu nga byagwa ekibaleetedde okufoosingibwa okukola embeera eteeka obulamu bwabwe mu katyabaga.
We must sit with our donors to see how best we can bring services closer to the community while we help them in some other way other than bringing drugs to them. Because they keep on asking you, are you giving us food as you bring these drugs? Because you know we need food and we're not working.
Ebitongole ebituyambako mu kulwanyisa akawuka, ebitongole bingi bivaayo ne byeyama okuyambako abantu abamu abali ku ddagala ly'akawuka mu ngeri y'enjawulo. Abamu bamanyi basuubiza nti tugenda batambuzanga okubatwalanga mufuna eddagala, oluusi ne babajja ku malwaliro gaabwe ag'okumpi oba ne babajja mu bitongole ebyabayambangako ebyokumpi ne babayambako omwaka gumu. Kati olw'okuba bali olwedde eri baali baavaayo bo ne batuuka ekiseera nga banafuye. Kati ekyo ne kirikendeeza ku adherence n'ebeera lo, kati ne kyongera obungi bw'akawuka. Lwa nsonga nti noono naye ne bw'onoomugamba nti we protecting oba kozesa kondomu oba tokkiriza muntu kugenda nawe mu kikola kya kwegatta nga talina kondomu, ajja kukubuuza nze ndi ewa, aba agenda kufunayo akasente akanaamuyimirizaawoko ne famire yo. So kati embeera COVID-19 akatyabaga keeyongedde okuleeta naddala mu HIV. Lubricants ye ali scarcity nnyo, nti bantu bangi bamuyinako mmimpi n'endowooza nti ensonga lwaki tebaagala mutunda oba mutambuza oba mugaba. N'ebitongole by'ebyobulamu ebisinga bitono nnyo ebimuleeta, birina okulowooza nti apromotinga homosexuality, naye ng'ate Lubo oyo atuyambako, ayamba okuziyiza okwenuubula nga muli mu kikolwa ky'ebyokwegatta, si ku baami bokka wabula n'abakyala. Enkwagulo ye n'omuntu oyo gwaba yeegase ne mu kikolwa kyetusuubira nti kiyinza okwongera risks z'okufuna akawuka ka mukenenya. Lubricants oyo tugenda kumuzaayo ku bitongole wamu n'okwegayirira ekitongole ky'ebyobulamu nti batuyambe bwe tuba twagala okulwanyisa akawuka akaleeta mukenenya. Tulina okutunuulira ebintu byonna bye tulowooza nti bimuziyiza. Mu byonna twetaaga tutunuulire lubricants, nti mu kubaawo kwa lubricants mu myaka ebiri egiyise emabega oba ogumu nti risks zibadde zikendedde. We are going to get more new infections among the KPs because these people already are vulnerable and COVID made them more vulnerable. Which hotspots were crossed due to COVID? Others who were positives, they reached to an extent where they even can't get their drugs. They can't go to the facilities. Some of them had no shelter. They had to come together in one room, which led them to practice unsecure practices like engaging in unprotected sex, no lubricants, because even if someone had money, he had nowhere to get that lubricant. No lubricants, because the other time had outreaches, we dialogues, they used to meet and talk. We used to go there for outreaches. We used to extend outreaches to the community. This time round, we couldn't extend any outreach to the community where these people they live. Adherence meetings where people who are on art could meet and share experiences. This time round, we couldn't organize any adherence meetings. Twitter hotspots, wetwabaweeranga services ez'awamu nga kati saawa zino kulw'embeera ya coronavirus olw'ekirwadde kino buli omu yafoosingibwa okudda ewaabwe oba okuddako ebbali okuva ewali ekifo ekyo, ng'ekyo kikaluubiriza service eziziyiza akawuka ka mukenenya batuukako, lwa nsonga nti oli baasangibwanga awo nga bangi nga kyangu okubaleetera PrEP, PEP, condoms, ate n'ekirala naffe ne ba service providers eri abakyala abo si kyangu kyakumuteebereza nti omukyala ono gye yagenda nti ateekwa kuba ali mu katyagaga ensonga abamu babeera wala ate nga muri hotspots zabeera nga ennyangu zakubatuukako.
I know of one lady I've been trying to help come back to art and also adhere well. She was bad off. Right now, she needs a lot of nutrition. She doesn't have money. So unless we support her, she's bound not to take her medication. So many people have not been working. They don't have jobs. They don't have livelihoods. Most people have been struggling. But then we know that the number one effect of HIV drugs is they need to eat, they need to drink, they need to live life.
They should not forget that HIV is around, and they also teach it as they recommend the teachings of COVID-19 on social media.